Hi everyone. So I know you've heard quite a few times already about PDSAs, I'm sure. So I want to focus, we'll just quickly for anyone new, that they're a simple way of testing change and that you can start. I think the big thing is starting small that I want to look at, and the principles are that you start small, you measure what you've done, and you try and test across a wide range of scenarios. So I'll come back to that in a second. So how many people have done at least 5 PDSAs, do they think? I think part of what I want to talk about today is that often I think that thing of starting small and just trying something little is often a way to get in there and get things happening, because when we're busy, the idea of planning an experiment can just feel quite overwhelming. But then actually, once we've done it, what are we doing next? So I think this slide idea has been shared quite a lot over the years, that you see this, that we try one thing, it goes perfectly, we try another thing, it goes perfectly, until we find the final solution. I think a few years ago, some med students did some research and their representation was more like this, that it's somewhat chaotic, you hit barriers, and that is true, but I think what we find is actually doing PDSAs is a learning, it's an iterative process that we make a plan. What do we think is going to happen? We predict. We then give it a go, see what the outcome is. Okay, so did it happen the way we expected it to? Okay, no, it didn't. What do we change? How do we try that differently? So it's not a failure. It's that you were predicting something and it didn't quite work out like that. So I think I'd probably prefer this representation of what we do when we do PDSAs. Some are you plan them and you try a few different cycles, and your idea just for whatever reason doesn't match up with actually the reality and it's not successful. Others, you see quite quickly that as you make modifications to it and you learn from it, that you end up with a change that you want to implement. And you often have these failures, but when you have those wins, they're worth celebrating. But these often, when you feel like it's a failure, it's just that opportunity to keep learning. So using the PDSA, I think we've had a few different forms used and people are using different forms locally, but one of the critical bits is talking about what's your prediction, and then once you get the outcome, what's our actions out of this? So we talk about whether we adopt, adapt or abandon. And so adopting straight off the first one means you've either come up with the perfect solution or you just haven't tested it in enough situations. It might work perfectly on the Monday morning shift, but actually, what about on Friday at 11 p.m? Like, is that actually same idea going to work? So actually what you tend to need to do a lot more is to adapt. So that might be trying with different client groups, different ward environments, different times of day, different staff, but actually just keep trying until you have a sense that this is actually going to work across all teams and all settings. And it might be that you end up with stratified plans as well, that actually during the day, X works really well, but on the night shift, we have to have a completely different strategy. And that is a big way to get buy-in as well from teams as well, because you'll find different ward environments and different shifts. People who are always do nights will see that their world and their work is quite different to those who are working the Monday to Friday. And I know, so I think that gives you the opportunity to test, and I think testing small is a key part of that. I'm going to just skip this for the sake of time. But what I wanted, your driver diagrams, and there's a bunch of awesome driver diagrams out on the storyboards out around, so when everyone gets the chance to have a look, to seek those opportunities to see what other people have been trying, you'll have multiple change ideas come out of that, and that can be quite overwhelming. So doing one PDSA can feel often big if you haven't done any before. So then when you've got 20 change ideas, the thought of testing all of them can feel like you need another 2 FTE just to do that. But what you find is that you can actually try and do little tests on multiple change ideas. So have concurrent work all happening at the same time. So you might find that one team says, yep, we'd like to try X. That change idea will do it with the third service user that presents on Tuesday, and that's who we'll try it with. Then someone else might have another idea, and it's that coalition of the willing, that people who are engaged with their idea actually want to test it because you feel good when your idea works, and you also can sort of generate that positivity within the team. The problem is when you start to move away from doing one PDSA or 2 PDSAs, it's hard to know whether, like where do we start? And so there are a couple of tools that can be used to track that. And a PDSA tree is a really simple one. And you have your change idea, and then you say, right, so what's our first PDSA? And you, just in a couple of words, you can document it in the tree, and you have your handwritten, so no one needs to type PDSA documentation for a start, just for saving time. Handwrite it quickly when you're planning it, handwrite your results, handwrite your next plan, and then scribble in here on your PDSA tree. What do we do? Okay, so we had an idea and we needed to adapt it. And so the next PDSA, we adapted that. But our first adaptation was the next one. It failed. That might have been because we tried it on the night shift and it just doesn't work in that setting. So we came up with another idea, and then we found, having tried that we end up with a change idea and a solution that works in a broad way or meets all those. And you just can do that. You can, for each change idea, you can generate a tree like this. So it's a simple, it's a PowerPoint text box. You just quickly type or scribble in what that change idea is and bring up when you're having team meetings and discussing what the next idea is. You just pull out the tree and generate that next PDSA. Some people don't like PowerPoint and they prefer Excel. I think when you're doing lots of PDSAs and you really want to measure and capture a lot of content, not just the high-level idea, then a table like this, which we can share with you as well, is a useful tool. So you're always tying it back to your aim statement at the top and your different change ideas. So I think just in closing, I think often PDSAs can be seen in a relatively narrow use, like just we've got to try making one simple change. Actually, they can be used in a multitude of different ways. So if you don't know how to collect data for your change idea, do a PDSA on that. Do a handwritten form that you scribble and go, okay, so what worked when we tried to collect the data that way? And then you build up the rigor of those PDSAs. You develop a change, you test it, and then you keep testing one area and then you spread. And then what you find is that actually that worked really well, and it worked well in one unit. So let's go back to the testing and implementation in another unit, and then potentially you can spread broader than that as well. So I think, just to finish, I think always be planning a couple of cycles ahead. So plan as if you're going to be successful and plan as if you're going to fail. So don't just think, oh, this is going to be terrible. So actually think, so if this works, where's our next stop? And that's likely to be a different shift. More people, more staff, more service users, different times a day. If you do small PDSAs, and I think this is probably, I don't know how everyone's found it up till now, but often we try and conquer our issue with one giant PDSA and then feel overwhelmed by the work. Actually doing it once with one person on a Tuesday or a whatever, just with a staff member who's willing to get involved, and I think this is key to the next step, is not everyone has to agree that we should test this. You don't have to get consensus. If you're testing an idea with one person once, there's no significant risk to that. If everyone agrees, let's just give it a go, then you create an environment where testing ideas, being creative, coming up with new ways of doing things, hopefully is encouraged rather than having to put a business case together to recruit people to try out a new idea that you're not sure if it even works. If you can, and this is again coalition of the willing, if you start scaling up and you need to do more, and we know testing change ideas takes more time. So if you've got people who are willing to do this as part, if they're doing it as part of professional development or something like that, you might find ways that you don't have to necessarily take from the staff who are on the shop floor on that day. So it's not always easy, but when people are engaged, they can feel personally connected to it and want to do it even as extra or as a development project. I think I've said it before, but test over a wide range of conditions. Try just whatever scenario you think this might fail in when you've come up with an idea, test it in that. And then if you think it's working in that, test it on more people in that situation. And there's no such thing as too much testing, it's just starting too big with your testing at the beginning. And I think the other thing is you have days like today, steal with pride. If someone has a really good idea, you don't have to go home and try and come up with it yourself. But don't assume that their idea is going to work for you just as it is. So you go back to this and you go, right, we've had the change developed. Let's test it for us locally. But there are loads of great ideas. The driver diagrams out there might trigger something for you that you just haven't thought of. And so steal that idea. Talk to the team here today who's come up with it. Take it home. Try it in your environment and see what needs to change for it to work for you.